The listening part of the occupational English test has 3 parts, and in each part, you hear a number of different extracts. At the beginning of the test, you will hear a beep sound. You have time to read the questions before you hear the extracts. You will hear each extract once only. You have to complete your answers as you listen. At the end of each test, you will be given 2 minutes to check your answers. Part A. In this part of the test, you will hear 2 different extracts. In each extract, a health professional is talking to his patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for Extract 1. Extract 1. Questions from 1 to 12. You hear a doctor talking to a patient called Alejandro. For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, doctor.
Good morning, Mr. Alejandro. Can you tell me about your problem?
Doctor, over the past week, I've been getting an increased shortness of breath and have also developed some abdominal pain. However, I was continuing my regular activities until the other day when I passed out at home. My wife called paramedics and I was brought to the emergency ward.
Oh, I see. What's your age?
35, doctor.
Your diagnosis report shows bilateral pulmonary infarcts and increasing BUN and creatinine. What medication you are taking?
Heparin.
Do you have any past history of any renal problems?
No, doctor. I was feeling completely normal until recently.
What about your appetite?
It's good.
Any swelling in your feet or ankles?
No, doctor.
Do you have chest pain?
No, doctor.
And your bowel and bladder habits?
Normal.
Any sudden weight loss?
No, doctor.
Your blood pressure level is 130 on 170. There is no organomegaly and no peripheral edema. Your laboratory reports show hemoglobin count 14.8, white count 16.3, sodium level 133. Potassium 5.1, chloride 104, and CO2 of 19. BUN test shows 26 and creatinine level is 3.5, and earlier it was 0.9. The CAT scan report of your abdomen shows poor perfusion to your right kidney. I think you have acute renal failure, probably vein thrombosis. Hypercoagulable state is indicated. Deep venous thrombosis with pulmonary embolism. Probably you have developed azotemia due to elevation of blood urea nitrogen, BUN, and serum creatinine levels. Your exposure to intravenous contrast materials may be the primary cause of your condition. I am going to prescribe you rivaroxaban 20 milligrams per day for anticoagulation. Hopefully with this anticoagulation, there will be some relief for your renal vein thrombosis. Or else, if your renal failure becomes progressive, I would advise dialytic intervention. I advise you to undergo a triple renal scintigraphy to investigate the 3 phases of your renal functioning system. In this diagnosis, a small amount of radioactive substance will be injected into your vein that is taken by the kidneys. This diagnosis involves the use of radioactive substance to investigate your kidneys and assess their function.
Thank you, doctor.
Extract 2. Questions from 13 to 24. You hear a physician talking to a patient called Mr. Zachary. For questions from 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, doctor.
Good morning, Mr. Zachary. May I know what your problem is?
I'm a patient of aggressive material, doctor, and I was admitted to the emergency ward at my hometown for evaluation of my disease.
When did this occur?
2 months back, doctor. There. My CT scan showed no hydronephrosis or upper tract process, but there was a thickening of the left and posterior bladder wall, so they referred to urology.
Okay. What's your age?
65.
Brief me about your past medical history.
A gunshot wound in 2000, followed by exploratory laparotomy twice.
What medications are you taking now?
Metoprolol 100 mg, diltiazem 120 mg daily, hydrocodone 10 out of 500 mg, pravastatin 40 mg daily, lisinopril 20 mg daily, hydrochlorothiazide 25 mg daily.
Are you allergic to any medication?
No, doctor.
So, I advise you to go for a bladder biopsy and a workup for a right adrenal lesion to analyze serum cortisol, potassium, and aldosterone and ACTH level measurement. Get this completed and meet me again with the diagnosis reports.
Okay, doctor. Hello, doctor. Good morning.
Hello, Mr. Zachary. How are you? Have you got the diagnosis reports?
I'm okay, doctor. Here are all the diagnosis reports.
The bladder biopsy confirms high-grade muscle-invasive transitional cell carcinoma with muscularis properia in the specimen, but the other workup seems to be totally negative. I am really sorry to inform you that the transitional cell carcinomas are really very difficult to treat. Muscle-invasive carcinoma is likely to spread to other parts of the body, and I have to get it treated either by removing the tumor or by treating the bladder with chemotherapy. I would suggest surgical resection of the tumor. However, the chance of reoccurrence is very common. You should undergo radical curative surgery in the form of a cystoprostatectomy with lymph node sampling. I would advise mitomycin into your bladder along chemotherapy as 6-dose regimen after resection of the tumor.
What is the chance for survival, doctor?
Actually, I will have to treat this muscle-invasive carcinoma more aggressively. Well, with your cooperation, I hope everything will go well.
Sure, doctor. I will extend my full cooperation. I have full trust in your experience.